Now to a health alert, doctors in our region sounding the alarm about measles.
Now, while we only have one confirmed case in the region so far, we told you about that one in Morgantown in April. Well, News Channel 3's Lisa Feinstein is talking with Valley Health's chief medical officer about how low vaccination rates and increased exposure is really causing a lot of concern.
Making a comeback, and not the kind you want. Measles posing threats to communities nationwide again after being pretty much eradicated in 2000. Now a case has been confirmed in West Virginia.
It is something that we need to be concerned about. The case number itself isn't particularly high when we think about other conditions that we see, like influenza or COVID, but for a condition that was all but eliminated through vaccination, 20 years ago, to be seeing it making somewhat of a comeback is concerning because we do have a very safe and effective vaccine that prevents it almost completely.
Valley Health Chief Medical Officer Matthew Weimer says most of these cases seen in the U.S. have been brought in from those traveling abroad. The challenge is that more Americans have been choosing not to get their children vaccinated.
Historically in the U.S., measles vaccination rates have been quite high, and in the last several years we've seen clusters or outbreaks of cases in certain areas, typically in relation to childhood vaccine rates being lower than they should be.
The major concern for doctors is how easily the disease spreads.
Measles is probably the most infectious virus that exists. It's a respiratory virus. It transmits through respiratory droplets, in some cases potentially a couple of hours after somebody with measles leaves a space. People in that space may be exposed and infected.
Per the CDC, the measles vaccine is the only prevention we can rely upon. Not having that layer of protection can make it even more difficult to know if you are infected or infecting others.
It's concerning because somebody could, say, come over from a trip abroad having been exposed to measles and not realizing it, and may infect people before they even have any symptoms. That incubation period, that period between the time you're exposed and the time you develop symptoms with measles, is anywhere from 1 to 2 weeks.
A reminder of the importance of routine childhood vaccines beginning at age 1 and again age 4 to 6. Lisa Feinstein, WSAZ News Channel 3.
And there may be some out there that are just saying, I'm not really sure if I'm even up to date on my measles vaccine. Well, if you're one of those, you can go in and get a booster. You could also consider a booster if you're about to travel abroad or you're a student about to head off to college.